After being shut down by the pandemic at one point, more and more dental offices are opening back up with hygiene changes in place. An estimated 80% of dentists are now seeing patients. And 3 News Now reporter Danielle Davis joins us live with more on what you can expect if you make an appointment.
Good morning, Courtney. I have to admit, I'm one of those persons that's just a little bit nervous about going to the dentist. But after a conversation with a top endodontist, I feel a lot better about making that appointment. Into the dental office, there are things you can do before you even arrive to make sure your visit will be one you feel comfortable with. When calling to make that appointment, ask questions about their safety precautions. And when you arrive, take notice of office procedures.
You should see the staff wearing masks. You should see them continually wiping down surfaces. That many of the offices should have you wait in their car to call you on the cell phone that the patient ahead of you has left the office and they're socially distancing properly.
If you do have severe tooth pain, it's not something you want to ignore. Specialists have tools that can also help with social distancing.
Almost 100% of endodontists use a microscope where we can magnify 10 to 20 times what's going on inside the tooth to understand how to treat it best. Most of us are able to take three-dimensional x-rays where the x-ray beam, the x-rays aren't put in your mouth. The x-ray beam is taken around your face. So that keeps us away from you. And best of all, 100% of the time we use a rubber dam. It is a thin piece of rubber that we can place over your tooth, put it over your mouth to protect you from our breathing on you.
As things can get pretty ugly, the sooner you make that appointment, the better your chances of them being able to save your tooth. And what we did as kids still holds true today, brushing at least twice a day and flossing after every meal. Now, if your pain is really bad, your first thought may be to head to the emergency room at a hospital, but they still need to concentrate on medical emergencies. And an endodontist is actually better because they receive an additional 2 to 3 years of training so they can quickly identify and ease your pain. This is Danielle Davis, 3 News Now This Morning.